Thank you, Philip, for introducing so well the aims of the Sunfrail project. I'm very proud and happy that Sunfrail and B3 are sharing this day. As Sunfrail is a network of reference sites in Europe, and one of these reference sites is the region Emilia Romagna. We have the director of the social and health sector agency in Emilia Romagna that will present some programs on aging in the region.
Thank you. Thank you. Good afternoon to everybody, and I want to thank for the opportunity to present what our region is doing to prevent, to support healthy aging. Why Emilia Romagna? Because the agency in which I'm working is coordinating the Sunfrail project, and we are also a reference site for the European Partnership for Healthy Aging for quite a long time. And can have the next, just a snapshot of the region in order to understand what we are trying to achieve. Is quite a big region for millions and a half inhabitants, and as you can see, we are quite elderly. There are a quarter of the population which is over 65 years of age. I will concentrate my very short presentation on primary health care, but at the same time we are trying to work on residential care and on hospital care, and opposite to the presentation this morning from Belgium, most of our hospitals are public, so it's easier to integrate with them. So I will focus on primary health care, and I will briefly present two innovations we have been setting up in the last decades, which are these community health centers, the so-called Case della Salute, which are an answer to the need of integrated care. And I will show briefly how they act, and this very new nurse-managed community hospital. The next one. Because we try to put in action what the European Commission has been promoting since quite a long time, to provide accessible, person-centered, comprehensive health and community services through team of professionals, which is the really challenge, making people working together, and with a sustained partnership with patient and informal caregivers, and I will try very briefly to give some example of that. The next one. So I will focus on three kinds of innovation. The one I already mentioned are new health services. The other one is to use big data. The Emilia-Romagna region has a very rich regional databases, and we are able to link all the information for each citizen. So all the encounter that citizen has with any kind of health services and social services, we are able to put together. And we are trying to use this data in order to promote a more team work and proactive work to identify needs in the population. The next one. So innovative health service, the next one. Community health center. The idea is to have, now there are 85 community health centers all over the region, and the idea is to be able to provide to citizens care comprehensive and continuous. These Case della Salute are open for long hours during the day, so they are able to respond to, the variety of needs. And professional, both from the health sector and from the social sectors, are working together. So it's possible to achieve the aim of offer individual care plan together. The next one, these are a map of the 87 community health centers, and other 35 are expected to be built in the next years. Next one. The other innovation is the community hospital. As I told, they are nurse-managed, and they would provide to the citizens the possibility to be cared for outside from the acute care hospital when they need something that is more complex than just being taken care by primary care professional. These are the map of this nurse-managed community hospital in the Emilia Romagna, and the idea is to try to achieve this aim. That means, as it has been told this morning several times, integrated care through new services, able to respond to the needs of the patient along the continuum of care, and using the community health center to put all the service together. But, as I told, we need also some innovative way of putting people together. I will present later on this risk profile that we are using in order to identify needs of the population with an approach at the entire population. I will present it later on in the round table. So now just other two very brief information. The other part we are working on is to involve communities. We think it's very important. And community health center could be the places where community can participate in a built-up model who are drawn on the specific needs of that community. And we are also trying to promote frequent meeting with population in order to promote prevention, knowledge of the needs, and health literacy. And we are also trying to be open and to use all the data we gather to be accessible by everybody, by the citizens, by the health professional. These are just a snapshot of prevalence of chronic disease. But everyone, if wants, can go to the website and look, for example, at indicator on how primary care is provided. So, just to mention that the Sunfrail project was born in this particular context, and I think it's an important step forward in order to be able to anticipate our capacity to identify needs in the population. So I think it will be a nice tool to cover the entire needs. And if somebody is interested in knowing more, there is a video on the Community Health Center, and you can go to the website and enjoy it. Thank you.